Anyway, very good morning. We'll start with a simple remedy. The last remedy we spoke was iodine. Any quick questions in iodine? Anything you would like to ask? Anything you want me to repeat in iodine? Right? And what was the key points in iodine? What was the key points? So mainly it's a glandular remedy. You all agree, you all remember it's a glandular remedy. And what exactly it does acting on the glands? It causes hypertrophy, absolutely right. And we also saw that the physical appearance of iodine was again very, very characteristic. What was it? They're very lean, thin, in spite of eating well. So losing flesh in spite of eating well is iodine. Okay. So anyway, iodine in detail we have discussed. So let's focus on a new remedy, a very important remedy that we are going to discuss today. I just start the class with a few small cases and then we'll try to understand the remedy that I am going to discuss today. As a final year student, looking at this image, what exactly comes to mind? Okay, surgical, absolutely right. Anything else other than surgical? Okay, surgery. Yeah, good. I use the word surgical. Chalo. Surgery, what else? Huh? Okay, can you just relate this to the homeopathic class that we are trying to understand? So there are some remedies, or there are some cases which can help avoid surgery. And some girl quickly said post-surgical. I'll also come to that. So when you come or when you talk about scope of homeopathy in surgical cases, there are two probable things you need to remember. One is we have some remedies which are capable of preventing surgery or assuming if the patient has undergone surgery, we have some remedies which can also help the patient in the post-surgical care. Okay? So what are all those cases that we can help here before they go to the surgery? Can you just give me some common, can you just name some common surgical conditions that we can help with homeopathy? What is that? Calculi? Yes, absolutely right. Calculi. Apart from calculi? Huh? Yeah, calculi, correct. What type of calculi? Renal calculi. We also have gallstones. Many cases we have been very successful in treating them without surgery. So gallstones, kidney stones, any other surgical conditions? Hernias. See, hernias you need to be a little careful. Okay. So if they are, that's why the knowledge of surgery becomes very important. See how severe the problem is. And from my personal experience, umbilical hernias, we have got good results. I might be wrong. But inguinal hernia, in the first grade, first stage, we have got beautiful results. When the contents are gone in, you need to be a little careful. Okay. So hernias, absolutely right. What else?
Amputation.
Okay, I mean we can also prevent certain amputations. I have shown you cases, gangrene. So we were successful in preventing the toe going under knife. Similarly, many cases of goiter, tonsils, adenoids, yes, very good, hemorrhoids, fissure. There are many conditions which we can successfully treat with homeopathic medicines. Cataract. See, cataract is more of a age-related problem. That. So again, I am talking to you limited to my experience. We can prolong. Again, I repeat, it's my experience. I am not cured in case of cataract because it's an aging process. It can be delayed. The process can be delayed. Right? So cataract. Now there are cases who come to us after surgery. Like recently I had a case of a young girl who underwent some surgical procedure related to her ovary, and after which it's been almost 3 weeks now, she has been continuously having pain. Right? So two scenarios you need to understand. If that girl had come to us 3 weeks before the surgery for that ovarian pathology, whatever, we could have looked at preventing surgery. That is one scenario. Now that the surgery is done, but she is complaining of pain. So what can we do here is, we have some beautiful remedies in homeopathic materia medica which can help the post-surgical part. So what medicine can you think of in this case? Very good, beautiful. Staphysagra. The girl again, she was in a second PU. She was again given a Staphysagra with beautiful improvement. Okay. So in today's class, we will quickly look at those remedies which in homeopathy it can be given for post-surgical conditions. Okay. I was happy with the word somebody used cataract. And you have a small scenario here. Okay. A patient undergoes cataract surgery, and after undergoing the cataract surgery, he is not comfortable. He feels that there's something that is pricking. I feel some foreign body sensation in my eye. Something is there, sir. So if you have a patient coming to a clinic with this situation, homeopathic materia medica offers one remedy. What is that remedy? Can somebody name the remedy? I'll give you the situation. I have not named the remedies. I thought we can have a small interaction. The remedy which absorbs small fragments after cataract surgery. Cataract surgery is done, but the patient is not comfortable. So something is there. I feel some kind of irritation. I feel there is some kind of a foreign body, some thread, something. Small fragment. He feels this there. So if you have a patient coming to your clinic with this situation, the remedy you need to think of is Senega. Kindly make a note. It can be useful in future. Senega is the remedy. And this is what is the second post-operative situation I was talking to you about. Okay. See what remedies come to your mind post-operative? Very good. Bellis, good. Acetic acid, good. What happens in bellis? When do you think of bellis? Bellis when? Very good. Bellis is when you have abdominal operations where the deeper structures are involved. Surgery where the deeper structures are involved, and then they have some discomfort, then they have some pain. You can think of bellis. Okay. We'll come back to the second situation. Pain abdomen after surgery. Pain abdomen after surgery. Single remedy. I give a case. The remedy is Staphysagra. Pain abdomen after surgery, and we look at the third situation. Now from the image, what can you make out? Surgery done, and what do you see here? Can you see some change? The pointer is not working, but if you just see this part here, what you realize is the bladder is full. The bladder is full. Generally, they do catheterization. You all know that. You have been exposed to nursing homes, clinics. You have an idea. So, for example, if there is retention of urine after a surgical procedure, the only remedy we have in our materia medica is causticum. Causticum. Retention of urine after surgery, causticum. Okay? Retention of urine. Then we look at the third thing. I have verified this particular symptom in my clinic. Almost 3 or 4 cases I can share. Now, what is the situation I have given? Thanks to Google Images. What is it that I have taken from Google? Sleeplessness. And what is our primary focus today? We are looking at surgical conditions. Okay. Sleeplessness which comes after surgery. Surgery is done. I have 3 cases or 4 cases. 2 cases were hysterectomy. They underwent hysterectomy. But after hysterectomy, the lady is not getting sleep. And one more old man, he had some problems over the lower limb. some procedure was done, and after the procedure no sleep. Okay. See, homeopathic literature has given you so many beautiful remedies, and I am trying to tell you all the 3-4 cases that I am sharing with you now is verified. Meaning, I have given them the remedy, and after the remedy, they have got good sleep. So if they come for surgery, we can have some help. If they come post-surgery also, homeopathy can offer some help to the suffering humanity. Now, what is this remedy? There are single remedies, and that's what is very catchy for young students. Very good, no problem. One of our friends says, young friend says, opium, no issues. But keep this remedy in your mind. Okay, some more situations will come up later, and opium can be a remedy there. No issues. Coca, no problem. What is coca all about? What is coca all about? Am I audible? In the Urdu? What is coca all about? Coca is more of a mountainous remedy. Fine. Many trekkers who go to high altitude, they take coca. One of our young homeopathic friend, she had become very famous in the group. Sir, madam, the fellow trekkers told you give something, and which will help us breathe properly and which will help our oxygen capacity. So she had become very famous in that group, trekkers group, thanks to coca. Right? Coca, mountainous remedy. Good. Somebody came up with another remedy. Passiflora. No problem. When do you think of passiflora? I am happy you thought of passiflora. Good. But passiflora is a remedy when there is nervous exhaustion, stress, tensions. It will calm down your nerves, and then you get good sleep. Okay. But here the situation is very specific. And what is the situation? Sleeplessness after surgery. The remedy is tikta. All 4 cases of mine beautifully improved. And I am sharing this on this platform so that many more patients can get benefited through homeopathy and through this remedy, tikta. Okay. Sleeplessness after surgery, epistaxis after nasal operations. There are single remedies, beautiful remedies, and if you get it and if you prescribe it, they give wonderful results. Epistaxis after nasal operations, you know this remedy. It's a rare remedy, simple remedy, there in your syllabus, and the remedy is a hemorrhagic remedy, and the remedy is thalapsy. What is it? Thalapsy bursa. Okay. Weakness after surgery in cancer patient. Very good, no problem. It's not carbohydrate. No issues. What are they? This speed, carbohydrates. It's not acetic acid. No issues. See, acetic acid also has weakness. Acetic acid has more of bad effects of anesthesia more than surgery. Acetic acid has bad effects of anesthesia. Okay. Then carbohydrate has weakness. When do you see weakness in carbohydrates? Carbohydrate has weakness after antibiotics. Single remedy. Weakness after antibiotics. Carbohydrates, single remedy. But here, weakness after operation in onco patient, in cancer patient. Single remedy we have is califos. Okay. So we'll go ahead. See, many times we have this peculiar situation. Sir, hiccups. I underwent surgery, and I have been continuously having hiccups. Right? I mean, these are the beautiful, verified literature given by our masters. Any wild guess? You'll be surprised with the remedy because you all know this remedy, but you won't have understood the utility of this particular remedy in this angle. Okay, and the remedy is hyoscyamus. Okay, so we'll move ahead. This is simple nausea after operations. What's the remedy? There are set of remedies, it's not a single remedy. You have bismuth, you have phosphorus, you have stephysagria, you have allium cipa. Okay. Vomiting after surgery. Vomiting after surgery. Any wild guess which is the remedy? Vomiting after surgery. The remedy is bismuth. The remedy is ferrum. The remedy is allium cipa. Vomiting after abdominal surgery, single remedy is bismuth. Vomiting after abdominal surgery, single remedy is bismuth. So vomiting after any surgery, you have a wider range, you have 3 remedies. What are the remedies? Allium cipa, ferrum and bismuth. Very good. We will come to the remedy that we are going to discuss. Here again I had a case I had shared in few webinars. You know, patient of ours, he had a huge stone, renal stone, and he underwent lithotripsy, they got it blasted, all those things. Post that he started having constipation. So you have a rubric in your repertoire, constipation after surgery. Constipation after surgery. Again a single remedy. Beautiful, good. That's why I told, keep your opium. It can be useful somewhere in future. So opium is the single remedy which has constipation after surgery. So moving forward, what we see is, what you see here is, there is, from the image, you can see here, you can appreciate that there is gastric distension. Correct, all of you? Now, this gastric distension or this flatulence has come after surgery. Okay, so it has come after surgery. So, while yes, post-operative gas pains. Yeah, good. I'm happy as a student you thought of carbohydrates. But carbohydrates are done already. So, a beautiful remedy that we should remember for this situation, single remedy, post-operative gas pains. I've given you the image and it is called wild radish or garden radish, if I'm right, garden radish. So, Raphanus is what we are going to discuss today. Clear? Boys, any quick questions? So, till now we saw few cases, few situations where homeopathic remedies can be indicated for post-surgical problems. Now, I have unveiled the remedy that we are going to discuss today, and the remedy is Raphanus. Raphanus. Okay? Fine. So, before I talk of Raphanus, I'll share a case from the OPD. He had gone to different doctors from different systems, and I just read, I kept it short so that we focus more on Raphanus. So what you see here is case in OPD of a young man, and he had anxiety disorder. What is it? He had anxiety disorder, and he had done a lot of tests, multiple tests, and he had gone to multiple doctors, visited many doctors, but unfortunately his symptoms were not better. When our PG, very young PG took up this case, he was going on and on, ma'am, I have gone to so many doctors, I have done so many tests. So when he came to me, I asked him, boss, what do you feel? That should be our next question. You have gone to so many doctors, you have done so many investigations, what do you feel? Very rarely I get an answer like this, and you know what was the answer? Sir, I have gone to so many doctors, done so many tests, I feel there is something that is missing. The doctors are not able to identify my problem. Okay? Fine? Must be I have a disease which no doctor is able to diagnose, no doctor is able to identify. Now this is the statement our patient gives. Now what is the challenge? converting the patient's language into rubrics. And luckily you are final year students and repertory is done and dusted. You are all ready for the exams. Right? Now the challenge is, how do we convert this into rubric? How do we convert this into rubric? Now I'll give you some time. You can think over and you can answer after a few minutes. I'm happy to see many mobiles being opened, and I only assume you are seeing the relevant topic. You are not checking or something else. But no issues. I trust you guys, but what is important is there was a small situation and we prescribed the remedy and he beautifully improved, and he also gave us a small testimony what had happened after the remedy. We'll unveil the rubric a little later. Now a small task after task. Sir, one task you have not completed and you are already giving us a second task. Now what is the second task? Second task is very simple. You will have to just interpret the Google image. You have to just interpret the Google image. Thanks to Google Images, at least through images we are able to study materia medica, which is definitely going to be interesting. Yeah, what do you see? What is your simple interpretation? Don't complicate, don't just see the image and let me know what is your interpretation. Huh? Who's that lady? Somebody said something. Lady? No, feel free. See, I've insisted when I give you an open thing, I should also have the guts to accept your answers. Right? So you are free to interpret your way. And let's see if that was right or wrong. First. Very good, beautiful. The girl comes up with a beautiful interpretation. And what is her interpretation? Indifference to her own child. That's what I like in her. It's not neighbor's child. It's not somebody's child. Correct, no? It's her own child. Beautiful, good, keep it up. So indifference to her own child. Beautiful, good. I like it. I didn't expect this. I thought we would tell indifference. Mother being indifferent to child. Okay, good. So what remedies come to your mind? Beautiful, good, keep it up. Sepia. Phosphorus, yes. You all agree with phosphorus? Because phosphorus is something we all know is very affectionate, very sympathetic. This can apply to phosphorus. Somebody else's child, she might take. Okay. And that is the, what is the sympathetic nature that you have in phosphorus. But as rightly told by a friend, phosphorus in the syphilitic stage can go into indifference. Phosphorus in syphilitic stage can go into indifference. Good, beautiful, okay. Any other remedies that come to your mind? So your interpretation is absolutely right, aversion to children. And going a little further, what you also see is aversion to children, or a person has an aversion to children and the aversion is typically for girls. I don't like a girl child. No? I mean, I know many in our country might hate this remedy. But you have to understand, Raphanus is the only remedy which is mentioned, aversion to little girls. Aversion to little girls. The gender is important. They have an aversion to girls. Right? Okay. So the other remedies having an aversion, you told phos, you told sepia. Few more I'll be adding platina. Beautiful remedy, platina. You also have lycopodium. You also have Hysteria rubens. And you also have sepia and of course Vijaykrishna. Now why platina has aversion to children? From whatever platina you know, you can answer this question. Why is platina having an aversion to children? What is it?
She may feel that attention will be given to her child, not her.
Okay, so platina might feel attention will be given to the child and not her. See, platina already has that strong delusion, she is great. Fine. So what is the platina thought? You should give. There's no question of not giving. Because they're fixed. That I am somebody very superior, I am from some other planet, I am very great, you are lucky to have me as your spouse. Fine? So you are forced to give attention. Then, so platina feels having children will be an interference. Having children will be an interference. Many times you have platina mothers, infertility, or not wanting to have kids. Why you don't want to have kids? No, sir. Kids is a nuisance. Kids is an interference. I hate that. I don't want kids. That is. Now, lycopodium, why do you feel they will have an aversion to kids? Lycopodium, simple remedy.
They don't like taking sponge.
Yeah. What will lycopodium tell? Sir, already I have one wife. Fine. You expect me to have another member in my family? No, I am not ready for it. Marriage only was a big headache. And I want to end here. I don't want to go further. So for lycopodium, having a child is a responsibility. Right? So out of responsibility, they will avoid having kids. Hysteria rubens has an aversion. Yeah, before Hysteria will finish sepia. You know sepia, they are indifferent to children. They want to go away from family. Fine? They want to separate from family. They want to separate from children. I had a case of a lady with cough few days back, and she has 2 kids. She recently delivered another child, and she is overburdened, and she says that I made a big mistake having another child. One was enough. So much of work. I now feel like going back to office. You getting my point? So wants to escape from children, wants to escape from family, and the lingering cough beautifully improved with sepia. Okay. So your senses should be very alert. What is the statement the patient is giving, and how do you convert that patient statement into the rubric is very, very interesting and challenging. Sepia feels like going away from children. Hysteria, they have an aversion to children, but they feel guilty about the fact that they have an aversion to children. Okay? Sir, I know I am not liking my kids, but at the same time, sir, I feel very guilty. I only gave birth, no, sir, to them. They did not come from somewhere. They came from my womb. I only gave birth. It is my duty, but I don't like them, sir. And at the same time, I feel very bad, very guilty about the fact that I am not liking them. So if you have this situation in your clinic where the mother has an aversion to her own kids and she is also feeling guilty for the same, you can think of Hysteria rubens. Hysteria rubens. Okay. So we'll go ahead and the mind of Hysteria, what did you understand? Mind of Hysteria is what we are trying to discuss. Aversion to children. Aversion to our own children, especially girls. Mother has 2 kids. One is a daughter and the other one is son. So she likes the son very much and she hates the daughter. She herself being a female, she hates the daughter. I don't like it. Right? But she likes the son very much. Okay. So it's a very common situation in our culture. Please do remember Raphanus. Okay. Continuing with the mind of Raphanus, what you also see from the Google image I have taken, this is the most decent Google image I could get. When I type the word, nymphomania. Raphanus is given under nymphomania. What other remedies as a final year? Very good, Murex. What is it? Murex, Calcaria. What are remedies? Lacasis, yes. Apis mellifica. Apis mellifica, Hyoscyamus, Veratrum, Lacasis, Stramonium, Oregano. I have told you about oregano. Yes. Now oregano is a rare remedy, and much better female will be talking about oregano. But now under mind, nymphomania in young girls. What is it? Nymphomania in young girls. Single remedy, oregano. Okay. Single remedy is oregano. Nymphomania in young girls. The scope of this platina is also having nymphomania. You know that. Nymphomania in young girls. We'll move forward. What do you see from the image? Good. Yeah, the word is right. I heard it right. What is it? They are hysterical phases. Raphanus is a hysterical remedy. Raphanus is a hysterical remedy. Everything is blown out of proportion. Okay. Which are all the other hysterical remedies? Hysterical remedies. You just wrote your exams. One paper. Okay, more than a part. Yeah, good, pulsatilla. See, hysteria, what is that remedy that should come to your mind? First remedy is English, very good. Asafoetida, ignitia, okay, aurum, cocculus, sepia. You have plenty of remedies in the material. Okay. I am just giving you few. Nux vomica, Nux moschata, platina, valeriana. Don't forget valeriana. Hysteria, and we'll move forward. So this is what I was trying to tell you. What does this remind you about? What does this remind you about? The case that I had given you as an assignment to find out the rubric. Did somebody get the rubric? Yes. Many of you are raising their. Okay, beautiful, good. So what is the rubric? Delusion has an unrecognized disease. I again have 3 cases where I have used this rubric. And trust me, when you use the right rubric, homeopathy will never disappoint you. But using the right rubric is very, very important. Delusion, he or she has an unrecognized disease. Nobody is able to recognize my disease is a thought patient has. And the only remedy is Raphanus. Good. For all the students who got it right, very good, keep it up. Sadness alternating with hopefulness. The lady is sad and at the same time she is hopeful. This is also hysterical. Anything alternating can be hysteria. Anything alternating can be hysterical. Okay. You are sad and at the same time you are hopeful. So that duality, that alternating thing can lead to hysteria. Calicarp and aconite are the 2 other remedies which have alternating sadness and hope. Okay, so we will move further. A small remedy, but an important remedy. Mind any quick questions? Voice drain. Raphanus is the remedy. And what we saw is the first thing, what did we see under Raphanus? Aversion. And what are they having an aversion to? Aversion to children. Top of it, own children. And on top of it, girls. And nymphomania and the delusion, she has an unrecognized disease. Sadness alternating with hopefulness. Hysteria. 5 points. So go ahead. Now talking about hysteria, what you see in this remedy? What you see in this remedy is, yeah, good, globus hystericus. But here you have a sensation in a lady that a hot ball is coming from the uterus up into the throat. What is that sensation? A hot ball coming from uterus to throat. It is not simple globus hystericus. It is not related only to throat. This ball-like sensation in this particular remedy, Raphanus, is coming from uterus and it is going up. 1. Now for a final year student, this can be a 5-mark question. Okay? Or this can be a question that can be asked in your Viva. And what is that question? Abdominal symptoms of Raphanus. Abdominal symptoms of Raphanus. Now what will you write under abdominal symptoms? We already gave you few clues. What is it? Flatulence, beautiful, good. And what is causing flatulence? See, flatulence, you have got so many remedies in homeopathic material. Yes? Good. Now what is the speciality or peculiarity of Raphanus in flatulence? Flatulence which is coming post surgery. Okay. Post operative gas pains. It can be a viva question. Post operative gas pains. Name the remedy. So post operative gas pains, distended, tympanic, hard abdomen. No, see there is abdomen is full of gas. But what is the situation in Raphanus? The gas is neither going up or the gas is going down. No eructations or no flatus. So what is the feeling the patient has? The gas is getting stuck. So you have a rubric or you have a word, incarcerated flatus. Incarcerated flatus. So retained flatulence cannot be passed up or down. See, many times we use China. Okay. But if it is post-surgical, please think of Raphanus. Okay. So post-operative gas pain, sensation of accumulation, incarceration of gas in abdomen, and you will also see vomiting, retching, vomiting of bile, and more importantly, there is vomiting of fecal matter. Vomiting of fecal matter. So two small questions. In which condition you will see fecal vomiting? First question. And what are all the homeopathic remedies? What would be the simple cause for fecal vomiting? Intestinal obstruction, intussusception. Good. Remedies? Remedies? Opium. There are many, but please do remember opium. Vomiting of fecal matter. Opium. Okay. So retching, vomiting, loss of appetite, vomiting of bile, and vomiting of fecal matter. This is what comes under abdomen. So this is important for you. Hope I am clear. There can be loss of appetite, there can be vomiting, there can be retching, and very important will be post-operative gas pains. Very important. Okay, we'll other remedies which has this obstruction of flatus in the abdomen or obstruction of flatulence in the abdomen. Other remedies, China, yes, argentum nitricum. Argentum nitricum. Pulsatilla. Colchicum. See, colchicum is also a beautiful remedy for tympanic abdomen. What do you mean by that? For a distended flatulent abdomen, you can also think of colchicum. Nitric acid and of course pulsatilla. You know pulsatilla. The last part of Raphanus, what did we see in the mind part? What did we see in the mind part relating to the image that I am trying to show you here? They are nymphomaniacs. Okay, they are nymphomaniacs. So, you also see tendency of masturbation. Tendency to masturbate. Okay, nymphomaniacs tendency to masturbate. And what we saw from uterus, a ball going into the throat. So here you have another sensation, a warm or a heat sensation, flushes of heat ascending from uterus to head. So hot flushes, menopause, flushes are starting in the uterus and it is going to the head, and from the head it is going throughout the body. So this is what you have in Raphanus. Female, nymphomania. See, nymphomania, masturbation, and we are talking of oregano, if you remember. What was the symptom given? Oregano. Nymphomania? Yes. How oregano masturbates is also very important. Single remedy, I had one case where a girl had expressed, they keep rubbing thighs against each other. Single remedy you have is oregano. She beautifully improved after oregano. Only one case, and I have to order the medicine for her because I have never used oregano. But in repertory, when we see this masturbation, rubbing thighs against each other, single remedy is oregano. Okay, oregano. The last part is sleeplessness. If it is sleeplessness after surgery, the remedy is, I did tell you a few minutes back, sticta, after going back to your notes. It should be imprinted, it should be there in your mind, it should never go. Don't let go of those things so easily. Because, they can do wonders, not only to your practice, they can do wonders even to your patients. Sticta. So we'll come back. What is it? Sleeplessness from sexual excess. Sleeplessness from sexual erethism. Sexual insanity. They are thinking only about sex. Right? And this is disturbing sleep. See, if you look into your repertoire, sleeplessness, there are n number of causes. Okay? But what is the highlight in Raphanus is sleeplessness which comes from these sexual thoughts. We'll have to connect the dots. Nymphomania, masturbation, to the extent that it is disturbing her sleep. Her thoughts are preoccupied with sexual thoughts. Any other remedies that we can think of? This situation, sexual insomnia, sleeplessness from sexual excitement. She gets sexually excited and then she loses her on her sleep. Then she loses on her sleep. Calibro. Okay. Antimonium crude and ornament. Calibro, antimonium and ornament are three remedies you need to remember. The last part will be the modalities. Touch, jar, motion, light. These are all the aggravating factors and they are ameliorated by walking and opening. These are all the ameliorating factors. Okay, so to conclude, we spoke of a simple remedy, Raphanus, and keeping the final years in mind, I have given what is important both for your theory exams tomorrow and for your clinics whenever you start practicing. Okay? So what we saw is, it is predominantly a GA remedy. It causes flatulence, and the flatulence in Raphanus is more specific when it is after surgery. And we also saw a lot of things related to mind. Hysteria, aversion to children, own children, girls. Okay? And then that ball raising up from uterus to throat, or that hot flashes going above. Any clarification? Anything you want me to repeat? Small remedy, but an important remedy. And that beautiful delusion, that's the only problem for which I have used Raphanus in my clinic. Delusion as a disease which is unrecognized. Okay? So thanks.